So as an OBGYN, I think my passion lies in the obstetrics part of OBGYN. I am really passionate about caring for people before their pregnancies, during their pregnancies, and after their pregnancies. I think it's such an intimate part of someone's life. To be included in it, and something that can be someone's happiest day ever is really such a blessing. I do know that the stakes are high as well, because when things don't go well in obstetrics, it can be a really devastating day. But to be there for that person in the highs and the lows is really what this job is about. So I think my approach to patient care is the same approach that I take to teaching, the same approach that I use with students, with residents, with everyone around me, and that's really trying to answer the questions of why. I think that a lot of the patients that I'm passionate about caring for, especially patients that are underrepresented in our community, a lot of times it feels like medicine happens to them and they're not really sure why these things occur. And I think my approach is making sure that they always understand why we're recommending the things we do, why we do the things we do, and why we're telling them that they should do certain things that are different. Right now, my clinical research interest is mostly in how we can increase minorities in medicine. The reason I came to Richmond and the reason I joined at VCU is because I felt like the Richmond community is rich with underserved patients. It is rich with a population that is underrepresented in medicine. But I think that it's fertile ground for us to try to increase those numbers. I think the most rewarding thing is when a patient feels completely empowered to take control of their own life. I think that patients that are in our community, patients that are majority minority patients, sometimes they feel like they don't have control of anything. And I think that that's not true. You know, there's so much that we can actually have some control of. Empowering them to understand that and empowering them to take back that control, whether it be things in their own health, I think is the most rewarding thing.